This is a memorial in Barre, Vermont. It's one of very few, though, and we'll talk about the reasons behind that, perhaps, that memorializes the victims of the Spanish flu epidemic. So the numbers, just really briefly, 50 to 100 million worldwide in less than a year died of the flu. About 675,000 in the United States in about 6 months, which is more than, like it says, more than all combat deaths of the 20th century combined. So World War I, II, Korea, Vietnam, the first Gulf War, all of those combined. And then 1 to 2% of Butte's population was killed in about 4 months of the flu in 1918. So you'll see the numbers broken out there by month. So how I came across these numbers, just real quick, I want to explain. This is only for the city of Butte. I didn't count the records outside of Butte, so the rest of Silver Bow County. This is just within the city. So there's just a titch over 700, which is still, even just for the city, probably a very low number for various reasons. So you'll see that November was a terrible, terrible month. I'm willing to bet that that's more people that have ever died in 1 month in Butte's entire history. The other thing I want to point out is that there are probably a few deaths, especially early on in the pandemic, that were attributed to something else, heart failure or just lung failure or something like that, that didn't get counted because people didn't quite yet realize exactly what was going on. So I want to keep that in mind as well. The other thing I really quickly want to point out is that this is what we call a mortality curve in public health. So a mortality curve is if we chart the mortality rate from a disease, we'll get this curve. So here we've got the age of our victims and the number of victims, and what's really significant about the 1918 flu is that it killed folks in the prime of their lives, really. So young men and women, young or middle-aged, my age essentially, were most at risk. Whereas it's usually our very young children and our older people that are more at risk. So that's quite significant. The other thing very quickly is that men and immigrants were also more susceptible, it seems, than other demographic groups, which if we think about Butte 100 years ago, that's an awful lot of people if we're looking at our immigrant population and our young men. But I'm not going to go too much today into exactly what the flu did and how it presented and those things. I did that a bit before, but please feel free to ask me any questions about that as we go through, if they come up, or if you have any afterwards. I want to talk about what happened afterwards today. So, economic effects. So we think if we're losing that rate of our population, we're going to have these economic effects. So higher mortality rates create a labor shortage. There's more jobs open because the people that worked them aren't there to go to work anymore, which leads to increased wages because now workers can demand more money because there's not such competition for those jobs. What's really interesting, though, that is important to point out here is that Butte didn't experience this. A lot of manufacturing cities around the country, Pittsburgh is a good example, had this, where they had a labor shortage. You just couldn't get enough workers. That didn't seem to happen in Butte, just because in the mines, there's always guys that are ready to work. Plus, with the end of the war, copper production really leveled off. So we didn't really see that effect here. But what people in Butte did see is increased poverty among the people that are left. Because when we look at that mortality curve and it's taking our young men and our young women, it's taking the primary breadwinners from a lot of families, or leaving some of them debilitated for a while so that they can't work anymore. So a couple of interesting statistics that I read. In the months after the pandemic, insurance companies in the US paid out, let me make sure I get this right, $100 million in life insurance policies, which today would be about $20 billion.
Wow.
But if you think about that, the folks that probably had those life insurance policies already, they're the ones with money. So the ones, are poor don't have money to get those policies, so they're not getting paid out those. So the other really sad statistic, they think that for every one person that died of influenza, about 4 moved below the poverty line for that. There were some changes in our life expectancy levels. So 12 years, in less than a year, the life expectancy level in the United States dropped by 12 years. So it dropped from, it wasn't very high for our 21st century standards to begin with, but it dropped down into about the 30s and 40s was our life expectancy rate after this. And it wasn't until the 1930s that that got back up to normal, to where it was before. Females had a higher life expectancy rate. After the pandemic, by about 6 years, after the pandemic, that kind of closed the gap, and there was just this 1 year difference. And that also hung around until about the 30s. Some effects on unborn children. Pregnant women had the highest rates of, they were the most susceptible, 50% more likely to develop pneumonia if they caught influenza, and it was usually the pneumonia that was the most deadly. And of those that got pneumonia, they were 50% more likely to die of it. So we have really high rates, high miscarriage rates that really put this little bit of a strain on the population, that really this kind of gap that is only now starting to level out because those children that would have been born were now reaching the end of their lifespan. So for the last 100 years, there's been a bit of a population gap because so many children that would have been born were not because of this. And the other thing is the infants that did survive, their mothers did make it and they did survive. They see a lot of ill health effects later on. So this photo is from a World War II in processing center for draftees. And they discovered when they were processing these draftees and measuring heights and weights and things like that these gentlemen were smaller in stature, the ones whose mothers had survived the pandemic and they were in utero. They were smaller in size, like smaller than average than most of the other men were. They were also less likely to graduate school, less likely to earn a reasonable wage, had higher rates of incarceration, higher poverty rates, which we can say there's a little tentative link between that, but I think it's still worth mentioning and bearing out in that. Mental health effects. So have any of you read the book by Oliver Sacks or seen the movie? It's called Awakenings. It's about, okay, we have a couple. So it's about some folks who kind of go into this paralytic state. They get what's called encephalitis lethargica, and there was this huge kind of wave of it across the United States, and it peaked in about 1921. And what researchers found is they found this really tentative link between pandemic survivors, folks that got the flu in 1918, and those that came down with encephalitis lethargica a few years later. So they said that could be hanging around a little bit. It's a tentative link. And then survivors also had higher rates of chronic fatigue syndrome and quote-unquote melancholia, which we would call depression. So a lot of mental health effects there too, which is completely understandable if you've watched your friends and your family suffer and lost some of them. And then we have all of these children left without parents after that. My grandfather lost his father and then was moved away from his mother. The Butte Silverbow Board of Health records say that by mid-November, the city was caring for 50 children who lost their parents already in mid-November. And those would just be children that don't have other friends or relatives to look after them, but there were so many more. And we'll talk about those later on, a few specific, really kind of uplifting stories after all the depression that I found. So I said we were going to get really big, and this is where we get really big with this. So the flu had a lot of major impacts worldwide and politically for political structures worldwide. The flu is, you cannot talk about World War I or the flu in 1918 without talking about the other. One of the most popular origin theories for the pandemic was that it started in Kansas, and some farm boys took it from their small town to Fort Riley, and from there it just spread. So if we think about our young men packed on these ships going to Europe, and then in their camps over there where conditions probably aren't the best yet, because up until now, you know, more men died of disease than they actually did in battle during wars. So if we think about that, we can think of how it spreads. But both sides, both the Allied and the Central Powers, were hit with influenza in early to mid 1918. And get ahead of myself here. The German commander, Erich Ludendorff, kind of blamed the flu on the Germans' failed offensive in 1918. He said, we were too sick. It's not, you know, they didn't get as sick as we did, and it just didn't go the way that it should have, because we couldn't mount the attack that we wanted to. So that and diminishing supply lines kind of brought about the end of the war. It's really hard to say that the flu was what picked a victor in the war, but I think we can definitely say that it maybe brought the end about a little sooner than it otherwise would have come. The other thing that is super interesting about this is that in Paris, when they were drawing up the Treaty of Versailles during peace talks, President Woodrow Wilson came down with the flu in early 1919 while this was going on. He went into the peace talks really hoping for to negotiate a peace that was kind of moderate. He didn't want to be as harsh as the British and the French did on the Germans. Then he got the flu. And it seems like he kind of changed his mind after that. He was really irritable, and of course he probably just didn't feel good and didn't want to be there. So he ended up just kind of siding with what the British and the French had planned, and these really harsh reparations came down on Germany to plunge their country into poverty, which led to the rise of the Third Reich. So, and some historians have said that this might be, we can never know for sure, but we might be able to say that this maybe was one of the causes of World War II, that it's tied in there somehow. Then, the appointment of Joseph Stalin. Joseph Stalin was kind of like fourth or fifth, like away from Lenin as far as things go. He wasn't really high up there. But the flu claimed Lenin's right-hand man in March of 1919. And Joseph Stalin kind of worked his way up there, made it past a couple of other guys, and emerged victorious as Lenin's kind of advisor. And well, we know what happened from there. So we can probably tie that in there as well. And then the other thing is the flu was kind of the beginning of the end for a lot of modern colonial structures. So the flu, a lot of historians have said that due to the flu, Gandhi was kind of put as the leader of kind of the rebellion against the British in India. And although their independence didn't come from several years later, they got their leader out of that. New Zealand, Korea, and Egypt are three other places who really soon after this saw their colonial structures start to fail. And the big reason historians think for this is that the native people in those areas suffered much higher morbidity and mortality rates than their colonizers did, because there was such disparities in healthcare and public health there, and they just didn't get the care that the colonizers did, and enough was enough. So a lot of things worldwide that, like I said, affected all of us somehow. I want to talk about, too, the changes in public health and how public health worked then compared to how it works now, specifically with disease control. The other reason, besides my family history, that I got really involved in this is I've worked in public health for about 6 years, specifically with communicable disease and emergency preparedness and response to communicable disease. So the topic was a little near and dear to my heart anyway. Well, what I found really interesting in this was just how the system we have in place today, how much was influenced by what happened in 1918. So before 1918, disease was really seen as a product of unsanitary conditions, overcrowding, and poor nutrition, which, yes, to a certain extent, all those are very true, because we are not as healthy if we're not eating right and we're just living in terrible conditions in a crowded space. But, so, whoops, like the picture there, so that's the 5 Points neighborhood on the Lower East Side of Manhattan, which was not a great place to live in the early 20th century. But I looked at this picture and then I thought back of all the pictures I've seen of Butte in the early 20th century and some of the neighborhoods. And so then I looked at this one and I was like, those little houses are all crowded together and it's all dirt and they probably don't have plumbing and things like that. So it's a really comparable situation there. The thing, though, that was different in 1918 was that disease was also seen as a moral failure because it affected the poor mostly, but the rich people didn't say, well, it's because they don't have the money to clean up their neighborhoods or to get proper food. They're just like, they need to do better. It's their fault, they need to do better. And more than that, they need to stay away from us because they're spreading their afflictions to us. So the rich blamed, I get really loud when I turn this way. The rich blamed the first three on the poor because they were just failing at life, essentially. So before 1918, the big focus in disease control. The first one was sanitation. So this is also a picture from New York City in 1918 during the pandemic. So keeping the streets clean was a big thing. This happened in Butte as well. The Butte Board of Health said no sweeping. If you're gonna sweep your sidewalks, you need to spray down this disinfectant first because we have to keep the dust from swirling up because the germs will swirl up then too. Don't spit on the sidewalks, that's good advice anyway. And then they had to flush the streets with water. So we'll just turn the fire hoses on, flush everything down the hill, down by the tracks probably got the brunt of it, but it was clean up here. So when I was writing the book, I think I put a line in there that says there may not be any other time in history where Butte is as clean as it was in November of 1918. The other thing that was a big focus in public health and disease control was isolation. We're just going to keep those that are sick completely separated from us. It's also not a bad idea, but it was the way that it was done that was not so great. So there's this historian I was reading, and she wrote about this. In context of an epidemic, public health generally referred to a suite of measures designed to protect those elites from the contaminating influence of the disease-ridden rabble. So if we keep the sick, poor people away from us, it's going to keep disease from spreading. So we can see these instances through history too where this was taken. So during the Black Death in the Middle Ages, and even during the cholera outbreaks and epidemics of the 18th and 19th centuries, the rich people would just leave town and take their doctors with them most of the time too. They would just leave town, leaving everyone else to kind of deal with it themselves and keep themselves healthy. And you know, let's just lock up the sick and keep them away from us. So if we've heard of Typhoid Mary, the poor woman spent 20 years locked in an island in the East River because no one wanted to get sick. Instead of figuring out how they could, while they figured out how to help her, I guess I should say. It was mostly not for her, it was to protect the rich people she worked for. So bringing this to Butte though, so in November 22nd of 1918, there was an order that anyone sick with influenza had to be isolated in their home, and everyone that they lived with had to be quarantined with them as well. So on that day, the Board of Health reported 127 cases of the flu. So if we think, okay, all of those people and everyone they live with has to stay at home, that's at least 250 people in Butte that can't go anywhere And I'm sure that number's a really low estimate. We think of everyone with children. The men that lived in boarding houses were subject to this too, and we know they're probably not all staying home. So that's a lot of people. So again, I wanted to point out, these are not bad ideas. It's just that they're very reactive and not proactive and very discriminatory. But here's what happened in 1918, is that influenza, it didn't discriminate. So this is John O'Meara. You may have heard his name. He was very prominent in early Butte history, especially during this time. He was from Ireland. He'd come to Butte as a boy. He worked as a tool boy in the Alice, I think, and then worked his way up and was, in 1918, by that point, he was the manager of Centennial Brewing. And was very well known in town, part of one of the leading families. He actually lived about a half a block away from William Clark's mansion. So if we want to put that in geography, he lived in a really nice part of town. So, but on October 24th, he died of influenza, as did his wife and one of their children. Walter and Arthur Muller were also kind of part of the same social circle as the O'Mearas. They were actually both pallbearers at that triple funeral, and were treasurer and president, I want to make sure I get this right, yes, respectively, at Centennial Brewing. So all kind of worked together, ran in that same social circle. By the first week in December, both of them had died of influenza.
Just to interrupt,
Sure.
the pictures on the wall are the plans and drawings of Arthur Muller's house. I was going to say, we just got this collection in. Oh yeah, it's right there.
Well, and what that does too is it tells us that these, how prominent these families were in Butte's history, and that they weren't part of the quote-unquote disease-ridden rabble.
Right.
One more, Catherine Sullivan Muller was Arthur's wife. She got sick in the fall of 1918. She was sick with influenza. She survived. Never fully regained her health. So in early 1919, she took herself to New York City, thinking that the change in climate and kind of would help her regain her health. And she set herself up in an apartment in the brand new Pennsylvania Hotel in Midtown, this lovely place. She caught influenza again, and she died in June of 1919. So, that same historian I quoted earlier that talked about the disease-ridden rabble, she also writes that it was no longer reasonable to blame an individual for catching an infectious disease. The whole world could see now that it's not just the disease-ridden rabble, but it's everyone. Everyone's susceptible, and that's what has to change. So, our public health systems changed a lot in the last century, beginning with this. So first, we need to set up, public health decided, we need this early warning system. We can't continue to be completely reactive to these things. So first, we have to determine a baseline. What is the health of a particular population like for the most part? What diseases are more prevalent in some areas? What are not? What's unusual? What's abnormal? Because then once we determine that baseline, we can implement monitoring and detection systems. Because if we're looking at how healthy our population is, we can figure out very quickly if it's unhealthy. And then we can decide what we can do to make it better. So around the world, we see the rise of government-funded public health and healthcare systems. So public health systems in the United States are funded in an awful lot of ways. A lot of it's federal. Some of it is, government or federal funded. A lot of it's municipal, local government funded, but they're usually government funded. Healthcare is a little different, but in a lot of places around the world, it became a government funded system because this way, we have a system that's population centered. It's inclusive of everyone. We can provide medical care for the poor, even if they have trouble paying for it, we can still provide it for them. And this allows us too to track non-communicable health issues, so things like heart disease. In the last century, we see that there's really some emphasis put on keeping track of things like heart disease, and in the last few decades, things like suicide rates and gun violence. So we can start to track those things because we're more population-centered now. And not just track them, but try to figure out how to make them better. So, formation of systems like the National Health Services in Britain, the World Health Organization, and here in the United States, the Centers for Disease Control and Prevention really grew out of this movement to make public health and healthcare more population-centered. So in Montana, Dr. William F. Cogswell, he's not, unfortunately, we can't claim him as a Montana native, but he came here in 1908 and he was the health officer of Park County over in Livingston. He worked on the Board of Entomology with tick-borne. Tick-borne diseases were a huge deal in Montana in the early part of the 20th century. He did a lot of work with those. And in 1912, he was appointed to the State Board of Health. And in 1918, he was serving as the secretary of the State Board of Health. What he really wanted to do, though, is he wanted to join the war effort because it was a lot of folks' goal to make World War I the first war where we lost fewer men to disease than we did to combat. That was the goal. So he thought he could really, his expertise in communicable disease, he really thought he could help. The other Board of Health members were kind of not willing to let him go, so they deferred their decision, which actually ended up being a really good thing for us, that they did not let him go. After the pandemic, he was really the leader in creating the position of the state epidemiologist, someone based with the State Board of Health who could look statewide at the reports coming in to track communicable diseases. And the current procedures that are followed in public health came directly from this. He wrote, about a year after the pandemic, he wrote, "Our memories of this and other epidemics should not fail. Let us hope that through preparedness in health organization and in the education of new generations, we may prevent a repetition of the terrific losses which influenza has caused." He's like, there has to be something that we do about this. And creating that monitoring and reporting system was the biggest thing. And today, so he was also, I'll just point out, I really like this guy. He was instrumental in creating the Rocky Mountain Lab down in Hamilton, which is a National Institutes of Health biomedical research facility. They do some great, interesting work. And up in Helena, the State Health Department's Communicable Disease and Epidemiology section is housed in the Cogswell building. In public health, we have this phrase that we say boots on the ground. These are the people, not in Helena, but in our own communities that are actually doing the work that the folks in Helena have asked us to do. So here in Butte, there's a few people I wanted to talk about. Dr. Dan Donohue, he was actually the president of the State Board of Health, but he served as the Silver Bow County physician. So he was very active in control measures and the response here. He was also a commander in the local National Guard. He served in the Spanish-American War. And yes, he practiced in Glendive, which is where I'm from, before he came here to Butte. So I thought that was interesting too. They called him Colonel Dan, I think. Dr. Walter Matthews was the Butte city physician, so he was also very, very active in this response. Quite the photographer too, I learned that he was a very good photographer and did a lot of great work with x-rays after the pandemic. Dr. Jed Point was the Butte Silver Bow Board of Health Secretary, which means his job was enormous in the fall of 1918. He was responsible for getting and reporting out the numbers of people ill, the number that had died every time the Board of Health met, which was every day for a few months. And interestingly enough, October 1918 was his first month on the job. So the poor guy kind of had a trial by fire, but figured things out very quickly. He was responsible for enforcing control measures too, which was not a very fun thing to do. But I want to point out, this is not him. This is his father, Isidore Freund. I could not find a picture of Dr. Jed. But according to his World War I draft card, he probably looked a lot like his father. His father was a partner in Murray and Freund Hospital, which I believe was right
In our
over there. And Dr. Carolyn McGill. Dr. McGill was the first woman to earn a PhD from the University of Missouri. She came here to Butte, did a lot of great work with tuberculosis, which was huge here. Butte had, I think, the highest rate of tuberculosis deaths in the United States during that time. She did a lot of work with that. She got her MD from Johns Hopkins and came back to Butte, and a remarkable woman. So she seemed to have followed that, against the times of a lot of doctors only not caring so much for the poor. She visited miners, widows, and their children in their homes. She cared for the ladies in the red light district. She visited the saloons after bar fights to take care of folks. But she was not on the Board of Health. She was the president of the Silver Bow County Medical Society during this time. And she actually kind of butted heads with the Board of Health a little bit because she advocated for a complete shutdown of everything in Butte until everything was over. She said, you know what? We just need to shut everything down. People can't go any, shouldn't be able to go anywhere, do anything. That's the only way to end this. And we see from that kind of little bit of disagreement that they had. We see the differences really come out between healthcare and public health and what those two things do and how that really evolved during and after the pandemic. So influenza was affecting everyone, so we need to be egalitarian, they decided, in what we do. So healthcare, this is now. Healthcare is based on this patient level. We're looking at people individually and treating their systems based upon just them specifically. Whereas public health is this more community level. So we're looking at community-wide what's best for the majority. Now, if we think about that, what's best for the majority isn't always what's best for a specific individual. So this is the task that the Board of Health had when they were talking with Dr. McGill and the Medical Society is what can we do that's best for everyone that also focuses in on the patient. And so modern systems kind of really grew out of this. So it's two separate systems today, but they work in tandem. They have to in order to be successful. So this new system at work. So influenza, after this, joined a list of reportable conditions. Before the pandemic, doctors were not required to report to public health any cases of influenza. It just didn't matter. Today they are. It's a big deal. There's a list of, I think there's 63 on the list that public health is required, that doctors are required to report any case, suspected or confirmed, of those 63 diseases to public health for tracking. Influenza is one that we get reports at local public health, we get reports of anyone who's tested for influenza, whether or not it turns out to be a positive or not. We just need to know who's getting tested because maybe it was a false negative. How many people do they feel have needed to be tested for it? So that kind of grew out of this, is working with doctors and public health to see who is the most affected and afflicted. So in January of 1920, the Butte Silver Board of Health discussed, they're still talking about influenza. How are we going to handle even one case? Not waiting until we have a few, but what do we do if we have just one to make sure that we can stop this before it turns into more than one? And a side note on this that I thought was a little humorous is prohibition had gone into effect just a couple of days before they met and were talking about this. And so the Board of Health said, oh, by the way, any confiscated alcohol, let's take that and hold on to it for disinfecting purposes, specifically for influenza. In 1933, the influenza virus was identified in the laboratory. So in 1918, no one knew what an influenza virus even looked like under a microscope. They didn't have the equipment available to see it. They did in 1933. So they knew how to recognize it by symptom, but the laboratory confirmation wasn't possible until the 30s. And in 1944, there was a vaccine developed. It was first given to our troops in World War II, and then when it seemed like it worked pretty well, it was given to the general public. And now, today, like I mentioned, we have this very active system to monitor for not just influenza, but let me tell you, if you work in public health, it takes up most of your life for about 6 months out of the year. This monitoring system based on testing, so working with physicians and public health physicians working together for testing and then reporting those cases and then treating. So public health can give recommendations to physicians on treatment or, using antivirals if someone has influenza, maybe testing relatives or starting antiviral treatment proactively. So public health and healthcare work very closely together now for those things. Coordinated through local, state, and federal. What's really great though, what I love, is that Dr. Cogswell implemented this system in Montana before it was federally required. So Montana was really ahead of the curve on this. So now communities, individual communities, not just states, have response plans in place to deal with these types of things. So in 1918, James Finland offered his hotel as an emergency hospital because there were so many patients. They were just overflowing every other hospital in Butte and Silver Bow County. They ended up not using it. They used the middle school instead. But I love that story. But today we have systems in place where that hopefully wouldn't be necessary because local jurisdictions have these plans. They've already planned out what facilities they can use, how they can set them up. They know where they can get supplies. The federal government has all kinds of reserves of medication and things like that and different supplies to help set these things up. So that grew out of this too, is this, hey, we need to be ready for things like that. We can't be so reactive with our cleaning and our isolation and deciding after hundreds of people are ill where we're going to put them. We have to know ahead of time. All right, so kind of to wrap things up, I wanted to talk a little bit about why, if the pandemic had such a huge impact on the world and on every community within it, why it seems like we don't really remember it. I've seen more, I've been studying this for 4 or 5 years, but I've seen more in the last year because of the centennial, but you don't really hear about it until that. So one of the ideas I want to propose is that everyone just kind of felt like they lost control, just completely lost control for a while, especially our medical practitioners, our healthcare workers. They just didn't know what to do. For a long time, they didn't even really know exactly what disease they were dealing with because this influenza just presented so much differently than it usually did. It was really violent and horrifying, really, what it did to people. And so they thought, is the bubonic plague back? Is this, I'd read it before and then I saw it in the exhibit downstairs. A doctor in Chicago's like, it's because we're not eating sugar anymore because of the war. They thought, is it biological warfare? What is it? So they didn't know what it was. They didn't know how to treat it. And even after they figured out it was probably influenza, they still didn't know how to treat it. So this nurse, she was from Red Lodge and she was stationed at Fort Riley, which, if we go with the Kansas origin theory, that's ground zero. But this is what she had to say about a year later. She said, the worst epidemic I ever saw in my life was the meningitis. You got the flu and you died. You got meningitis and your head would sit on your seat. From meningitis, we went to a measles epidemic, and from measles they all got pneumonia and then pneumonia, which is blood infection. But What I really notice in this is her words about the flu. You got the flu and you died. There was nothing that they could do about it, you know? So if there's nothing that I can do, I'm going to focus on the things that I do know how to treat and the things that I can do something about. Another thing that's really interesting is in 1919, I think it was 1919, the Montana Nurses Association had their annual meeting, and they spent a lot of time talking about wartime service. There was not a single mention in the notes from that, and I went through all of them to make sure there was no mention of the flu, none. And I wonder, this is me speculating, but I wonder if it's because let's focus on the things that we could do something about, and the things that we were successful with. So medical science made a lot of strides in the years leading up to 1918, and then a lot of strides in battlefield medicine in World War I, and they were dealing with some terrible things with trench warfare and chemical warfare, and they grew a lot. There was a lot learned, but let's focus on those things that we learned and the things that we did well, and not what we feel like we failed at. Because I think all of us kind of want to a certain extent to choose what we remember. So, do we want to remember auxiliary hospitals? This is not a hospital, I don't know what it is.
It's like a where?
It looks like a warehouse. Yeah. I always think I see the banners in the back and it reminds me of a building at the fairgrounds or something. But do we want to remember an auxiliary hospital crowded with ill and dying and maybe dead patients? Or do we want to remember our streets crowded celebrating our victory in World War I and everything that we'd overcome? And then the other thing that I think would be a mistake for us to do is not us, let's not blame ourselves, we weren't around, but did our forebears kind of try to forget because they didn't want to think that something so terrible could happen ever again? I did want to talk, I said I would talk specifically about some other people's legacies since I talked about my own. And I stumbled, not literally, but very figuratively, stumbled upon these stories, and I am so glad that I did. Before I get to Norman there, I want to talk about the Muller boys, Arthur Jr. and Charles. You know, their parents both died. They were taken in by relatives and went to school and graduated from college, and Arthur joined the military. He was on his way to North Africa to work with the French, I think, during World War II, and unfortunately his ship sank, and he was never heard from again. Neither was anyone on the ship, so that didn't have a very happy ending, and I'm sorry for that. His brother, though, survived well into adulthood and had a very large family. They ended up out near Big Timber, I think. So there's that. Like I said, there's people still around that have their own stories. I want to talk about, I was a school teacher for a while, and one of my favorite phrases was remarkably well-adjusted, because there were some kids who came from absolutely nothing and had every excuse to be nothing, but they weren't. They were amazing. And I found a couple of stories that reminded me of that remarkably well-adjusted. So Norman was one of them. His parents, their names are on that board downstairs. They both died about less than a week apart when he was very, very young. And he went to live with his uncle. And he graduated, let me get my notes so I can get all this right. He graduated from the School of Mines and then went to work for the American Smelting and Refining Company. So he worked for them for his whole career, but he worked his way up. He was the general manager of the Northwestern Mining Department over in Wallace, Idaho. Then they moved him to the general manager of North American Mines down in Tucson. And eventually he became the vice president of the whole deal over in New York. So, remarkably well-adjusted. Oh, and he got an honorary engineer of mines degree from the School of Mines. And then Wayne Busenich, his parents are also on that board down there, as is his infant brother. He was, forgive me, I can't remember how old he was at the time. He was very young though. But he and his other siblings had lived in the United States their entire lives, but after they lost their parents, a relative took them to Serbia, where their parents were from. And so he grew up there in a small home with no electricity or running water, and out in the country, just kind of tending the livestock on the hillsides. When he was 15, he chose to move to Los Angeles with his grandfather. He taught himself English, because he didn't speak any growing up in Serbia. Taught himself English, worked his way through school, and eventually earned a PhD in Slavic languages and history from the University of California at Berkeley. So he worked for the government for a while in foreign affairs, specifically with the Balkans, and then he became professor at Stanford and was very well regarded. And so if you look at their history department, specifically Eastern European history and Slavic history, his name is there a lot of times. He's got fellowships and scholarships named after him. And yes, so again, remarkably well adjusted. And I'm sure that, again, I want to say there are people in this room probably that might have stories like that, just of family and where you came from, where family came from all of this. And then your fair city. I do want to point out that one of the things I learned from all of this is how remarkable this place is and the people here, because Butte did not react the same way that a lot of places did during this. There were a lot of cities where public health officials didn't have a lot of trouble enforcing closures on businesses and things like that, because people did not want to go outside because they were afraid. People quit helping their neighbors because they were afraid, and that didn't happen here. There was a lot of uproar about everything. A lot of people were arrested because they wouldn't follow the rules. There was an ad, one of the theaters had an ad in the paper that talked about the quarantine, and I don't remember the exact words. I wish I put a picture of it on here. But it said, we know the real story and not what someone thinks, because they wanted people to come to the theater. And we're like, look all around, y'all are healthy. Why should you be locked up, right? So Butte was really special in that regard. And I always really like that, because it just shows the city's resiliency and how the people just refuse to be told what to do. All right, so that's, I could go on and on, but I've used almost all of my time already. So again, thank you all so much for coming. Thank you for letting me be a part of your city for the last few years. So if you have any questions, please feel free to ask me. I have written a book on all of my findings in this from the last few years. It's due to be published in May. So if you are interested in that, I'm sure we could work something out with getting copies here in town.
Have you talked to Ellen about?
I have not. Last time I talked to her, I wasn't sure if they were going to publish it, but they are.
Okay.
So.
Well, good. Talk to them over there. What's the name?
Yeah. So I'd be happy to talk to any of you. And the other thing is, I would love to hear your stories too, because I know I've just mentioned this topic in passing to so many people, and they were like, oh, yes, so-and-so in my family, they had the flu, or my great aunt died of the flu. And I think there are so many of those stories, and I think if we really take the time to look at them, we can look at our own lives and say, it's very different. And in my case, I might not even be here if that hadn't happened. So I think it's important that we remember where we came from and how that got to be. So anyway, thank you.